Hello, I'm Armin Budish. Welcome to Golden Opportunities.
Today, PT has helped many folks get back to feeling A-OK. We'll work out why physical therapy is so successful. Fearful of family feuds during the upcoming festive season? We've got advice to make the holidays happy. Then, the details about decay in the older generation. Plus, as you age, is your good back going bad? We've got straightforward advice. And we'll give you a deadline you don't want to miss.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. If I told you I could help alleviate your body's aches and pains, unsteadiness, and fatigue without even taking a pill, would you be interested? This almost magical cure is no illusion, and neither are David Shell and Mimi Pekarik from Breckenridge Village Retirement Community. They're here to fill us in on this not-so-secret formula. David is the executive director at Breckenridge. Mimi's the director of physical therapy. Thanks for coming today.
Thanks for having us, Armin.
So David, let's start with you. You're the director of Breckenridge. Your community is not just for retirement, though. You can actually provide a great option for physical therapy.
Absolutely. We're known as a retirement community, but a lot of our work is done in outpatient therapy, and particularly aquatic and other land-based forms of therapy. And we know how critically important it is. We always hear the term, an ounce of prevention is worth a pound of cure. And particularly now with healthcare reform, we're going to try to do everything we can to keep people out of higher cost and higher levels of care. And this is a great one.
Mimi, you're the director of physical therapy at the Veal Wellness and Aquatic Center. Tell us about the how physical therapy can actually help people.
Armin, we're able to treat people with all the latest tools available to us. We have a very high-tech Balance Master piece of equipment that can test your balance skills,
find out more,
which are related to your age, as well as do some exercises with it. We can also do coordination exercises. We have weight equipment that we use also for a lot of our patients. And of course, we have a beautiful pool that has a very low level chlorine level in it, as well as it's a warm water pool, so it helps those with arthritis.
And while physical therapy typically takes time, you get to see people improve. Tell us, can you give us an example?
Well, we see, one of my favorite patients that we have seen was a patient that came to us with a very bad hip. And luckily, because we had the pool, our first thought is to get someone with a bad hip in the water, because the water is very supportive and warm, and then you can do a lot of exercises. Well, unfortunately, this individual also has very severe lung issues, and she has to be on oxygen. And she said, well, Mimi, I just can't use the pool. And I said, well, why not? And she said, well, I'm on oxygen all the time. I said, we'll take your tank in with you. And she said, oh, no, I can't do that. So we developed this flotation device, yes.
Our little MacGyver.
Where now she's graduated from therapy because she still has permanent damage with that hip, that she cannot go through a hip replacement because her lung issues are so severe. But she can get in 2 or 3 times a week and does water walking.
Floats along with her.
And she has a grand time.
And you actually created that yourself,
yes,
right?
I did.
That's not commercially available.
I think you can tell.
David, are we seeing more people, more folks being willing to use physical therapy instead of just popping a pill?
No, absolutely. I think that the more holistic approach and avoiding medication, if we can at all do that, is a great alternative. And people look more of a physical therapist as kind of a personal trainer, and I think that's a great way to approach it and to stay busy and active.
Now, Breckenridge is a retirement community. Do you have to be living there to take advantage of your great physical therapy opportunities?
No, about 50% of our clients are from the greater community near Willoughby area. And actually
But
one
you
of
can
my...
come anywhere,
You
from
can
anywhere.
come from anywhere. I've seen people as far away as, down towards Solon and beyond that from the south, and
Great.
from the west side of Cleveland as well. So
It's such a great facility, and obviously you and your staff do a great job.
Thank you.
Thank you. Appreciate it. So exercise your right to better health. You just might be able to choose movement over medication. To learn more, give your dialing finger a workout. Call Breckenridge Village at the number that's coming up. My thanks to David and Mimi for putting us through the paces when it comes to physical therapy.
To find out more, call Breckenridge Village at 440-954-8359 or log on to their website, www.breckenridgeohio.org. Next, relating to your relatives. But first, if you've ever been given the cold shoulder, you know you've suffered a snub. But how did we warm up to this low temperature term? And why a shoulder when it's generally used for shrugging? We'll serve up the interesting answer when we return.
I know the devastating effects that back pain can have not just on you, but your entire family. Instead of covering up your pain with drugs or surgery, we offer a procedure called non-surgical decompression. Decompression increases spinal disc space and it draws nutrients back into the disc. This allows healing to take place from the inside out. So if you're suffering with chronic pain, there is hope. I invite you to call our office to see if this proven treatment option can mean freedom from your pain.
The term cold shoulder arises from a bona fide beef. Back in medieval France, when a guest overstayed his welcome, the host served a cold shoulder of beef or mutton. It was a not so subtle sign it was time for the guest to get going.
Thanksgiving is almost here and the December holidays are right around the corner. That means spending time with your family, which should be a good thing, right? Yet a lot of folks find that their relatives can make them crazy. Thankfully, relationship coach Kathy Dawson's here with ways to make a wish for a happy family holiday come true. Thanks for joining us, Kathy.
Nice to be here.
It's great to see you.
Nice to see you.
Most of us love our families. Why do we end up anxious instead of relaxed and at ease?
You know what the problem is, Armin? The problem is expectations. We come into the situation expecting it to be like the Waltons, or the Brady Bunch, or a Norman Rockwell painting, and it's just not going to be that way. So we need to release the expectations and really focus on being with the people we love instead of the perfect napkin that goes with the perfect place card, that kind of thing.
Right. So to give us some specifics, what can we do to minimize the stress leading up to the family's arrival?
One of the best things you can do is be proactive with your mate and ask maybe a week or even 2 weeks ahead of time for help. Figure out, this means you have to think ahead, but figure out what it is you really need help with that day. But sometimes what happens is we don't think ahead, and then that day it's like, oh, Armin, would you go get the chairs in the basement? And by the way, while you're down there, will you do this, this, and this? And it causes a huge amount of stress. Now, also the mate can be proactive, and he or she can ask ahead of time, is there anything I can do to help you looking ahead in the next week? That really does a whole lot to reduce
now you've
stress.
just caused me trouble.
Go ahead.
All right, your next suggestion that you told me is to set time limits with people. How does that work? Doesn't it get rude?
No, this is really important. So say you're hosting the event, all right, and you want it to be a certain amount of time, because sometimes people come over and they stay a long time. So let people know ahead of time. We're going to have dinner at 6, and we're going to be together from like maybe 5 until 10. But put the time limits on there. Now, we have actually done this. For Thanksgiving, sometimes we have guests that like to hang out. We go to a movie. We tell everybody, okay,
What if they're still there?
We leave. This has actually happened. We have walked out the front door. We're going to the movie. You can come with us if you'd like, but we're leaving.
All right.
Okay.
What if you're going to someone else's house for a holiday gathering? What kind of boundaries do you set there?
Again, if it's a place that maybe you don't want to spend a lot of time, let them know ahead of time that you're going to be there for a certain amount of time. Yeah, we'd love to come. We're going to be able to come this time, and we're probably going to have to leave at this time. You don't want to leave right after dinner. Also, if they ask you to bring something, for goodness sake, you don't have to bring half the dinner. We put this pressure on ourselves. If you can do one side dish, that's fine. You don't have to bring 3 or 4.
You stop at the CVS, you pick up the chips, you're all set.
Exactly.
All right. All right, now, sometimes there's active feuds, family feuds going
Sometimes,
on.
yeah.
And is there a way to, do you take one side at one event and the other side at a different, how does that work?
No. Well, first of all, people often say, well, we shouldn't invite Aunt Martha with Aunt Betty, right? I come from the school of invite everybody. These are grown-ups. If they don't want to come, they'll decide whether to come or not, all right? And if they all come and there starts to be some tension and some arguing, stay out of it. Go to the point where you actually get up and leave the room if you need to. It just does no good to get in the middle of the drama.
Good advice. I'm not sure we can do it all, but
Even if you
thanks
can
for
do
the-
one thing, it'll improve the holidays.
Very good. Well, Kathy, thanks. As always,
Thank
great
you.
advice. So this holiday season, don't get wound up when you round up your relatives. Follow Kathy's advice instead of expecting perfection. Perfection's impossible. Try just enjoying them. And if Kathy's advice doesn't work, you try my approach. Ignore them as much as possible, then talk about them after they're gone. We'll be back.
For relationship advice, call Kathy Dawson at 216-932-5016 or click to www.kathythecoach.com. Next, you are what you eat, and so are your teeth. Looking for places to go, things to do? Welcome to our community calendar. This year, we commemorate the 50th anniversary of John F. Kennedy's assassination. So, what do we know now that we didn't know then? Find out November 19th at the Independence Library when Beverly Sadowski, a local historian, shares stories from her extensive research. To uncover more information, call 216-447-0160 or log on to www.cuyahoga-library.org.
All of the Halloween candy in your house may be gone by now. So sad. But if you munched and crunched your way through those lip-smacking sweets, your teeth may bear the brunt of your tasting, and candy isn't the only reason for decay, especially in older adults. Dentist Steve Marsh is here with jaw-dropping news about the alarming increase in dental decay in seniors. Thanks for joining us, Steve.
I'm glad you had me, and I have to tell you, Armand, this whole explosion of decay is something that I'm really passionate about in terms of eliminating. We joke about the candy and that sort of thing, but dentists are seeing today a huge amount of decay that we hadn't seen in a lot of years, and there are a lot of reasons for it that we'll explore here.
Well, obviously, if we eat a lot of sweets, decay, but what if we just have a sweet once in a while?
Well, it's interesting. When our kids used to go to Halloween, we'd say, go ahead and eat all the candy as much as you can at that time. Rather than do it every day, because what happens is every time you eat something sweet for about 20 to 30 minutes, there's an acid attack. So if you space it throughout the day, that means all day long you're going to get that acid attack. I had a patient who was in his 60s who every night discovered the wonders, he said, of dark chocolate, and he and his wife would sit in a hot tub and have a bite of hot chocolate. And what would happen was he came back in 6 months later and had lots of decay. Decay isn't only on seniors. Here's a young 20-year-old who came to me. His mom had been a patient for years. He was actually becoming a golf pro, Armand, and I said, you've got to tell me about your oral habits. What do you eat? And he said, I brush real well, but during the day I drink mostly Gatorade, which is full of sugars, and he said, I eat Cliff Bars, that sort of thing. So here's really, I wanted to show you a very graphic way. This is that same person, that same young man on the upper left side. That's what it looks like after the dentist has taken out all the decay. So we took out all the decay. We use a caries dye that discovers the decay so we know we get it all. And then you can see how I've restored it with composite. Now it looks really good on that upper left, I'd agree. You can see at that point I had not yet addressed the lower left. So again, his oral habit, though, despite his brushing, was all about the sugars he ate.
Are seniors particularly vulnerable?
Yes, because one of the things that happens is the gum that protects the tooth over the years, recedes, and that makes the roots more subject to decay. It's softer than the enamel, and that's another problem that we have as seniors.
And you have a picture or two for us?
Yeah, this is a patient who, another woman in her 60s, Armand, and that before is almost hard to look at. She came to me and her teeth were absolutely rotted. She said she was a big pop drinker. She drank it all day long. And you asked me earlier, is it worse if you have it? So all day long her teeth were being bathed in acids. It took a member of her family to sort of drag her in here. You see a beautiful after. That took lots of work. It was a huge investment on her part. And as we've talked in previous segments, she has to then maintain it. She had to get off the pop. In fact, I had to work with her on it. This before and after looks pretty good. The patient on the left, this is the same patient, We had restored her teeth in about 2007. She came back to me about 6 months ago saying, I'm having incredible pain. Though the restorations were in good shape, the teeth underneath had rotted, and I said, what's changed in your life? And she said, all day long at work, I have dry mouth, and so I've been sucking on mints all day long. So that constant acid attack eventually rotted those teeth that had to come out.
Medications, can they impact decay?
I'm glad you mentioned that. Things like high blood pressure medicines will cause dry mouth. Diabetics have a dry mouth. So we have to do things to fight that because you've lost the saliva. Now saliva will wash away a tooth. Saliva also buffers the acid. So when you have dry mouth, you are much more subject to decay. And for those patients, we advise they use biotin, these two products. One's called biotin. It helps keep the mouth moist, and the other is Prevident 5000. That's a prescription strength fluoride.
Wow.
You have to get it at the pharmacy. It should be prescribed by your dentist, and that helps fight the dry mouth and allows the patient to get a high concentration of fluoride. And speaking of which, one of the biggest problems we have now is everybody drinks bottled water. Bottled water doesn't have fluoride in it. So maybe when you brush your teeth, that's the only exposure you have to fluoride. So it's really important that we do as much prevention as we can.
All good advice, Steve. Thank you.
My pleasure, Armin.
As you can tell, we're not going to sugarcoat the very serious news that your teeth need your attention to keep decay from destroying them. You have two choices. Never ever eat sweets, or eat some sweets, have some fun, and follow Steve's advice. You can guess which choice I've made. We'll be back.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, oh, my aging back. It's time to get up and go, an exercise minute on golden opportunities.
Hello everybody, I'm Mike Carbon from Breakout Fitness, and today we're here to show you how to work those ever important calf muscles in the lower half of the leg. These are very important muscles because they help to propel us as we walk and even as we get up and down those stairs. You ready to go?
I'm ready.
Alright, we're going to need one dumbbell for this and a firm surface to have next to us just in case we lose our balance because we are going to be standing on one foot. Make sure the dumbbell is in the side that you're going to start with, so let's go ahead and lift our left leg, and then what we're going to do is simply raise up on our tiptoes and dip down to our heel. Okay, so get as high as you can on your tiptoes and then let yourself fall back down to the heel. Slow and controlled movements. Let's go ahead and switch sides. How you feeling?
That side didn't work so good.
Now let's try the other side. All right. All the way up, all the way down. Looks like you got it.
Is that it?
That's it.
All right.
All right. 15 to 20 repetitions, ladies and gentlemen. This is an endurance exercise, 3 to 4 sets, and you'll be on your way to stronger legs. All right, now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
It's an age-old problem. As you age, your back gets older too. And even if it never was sore before, your spine may start to show signs of pain and problems. Dr. Michael Steinmetz is here to help us bone up on how to bolster our back. Dr. Steinmetz is the chairman of the Department of Neurosurgery at Metro Health. Thanks for joining us today.
Thank you. Thanks for having me.
So what kinds of issues will arise as we age when it comes to our spine?
So we face a lot of issues as the spine ages. The spine tends to deteriorate over time, and it's occurring in all of us. And the key thing when we talk about this is that this is a fairly normal process. And why that's important is that not everybody develops symptoms from what we're about to talk about. But I like to categorize how the spine changes in 3 large ways as we tend to age. And first is the posture, or the orientation of the spine. We have normal curvatures of our spine when we're born and we develop, and those curvatures tend to straighten out over time. And why that maybe seems...
Then we'd walk straighter.
Yeah,
right?
well, it seems good because we'll stand straighter. We really don't. What it tends to do is tends to push us more forward. It tends to push our spine out of balance, and that can cause pain.
Is that why you see older people sometimes...
Yeah, that's right.
Bending
Sometimes
over?
they bend over and stoop over. It's often due to that straightening process of, of degeneration.
Yeah, what's the second issue?
So the second issue is arthritis. And what does that mean? Arthritis is not a clear term. It's somewhat of a vague term, but it is really that term we use for the degeneration of the spine. And what happens there is the discs in the spine collapse, they bulge. Everybody knows somebody with bulging discs. We develop bone spurs, and this can develop into pain. You can get pain like you get in your knee or shoulder when you get bone-on-bone disease, but it also can pinch the nerves and cause arm pain or leg pain. And that's probably the biggest thing we see when people develop symptoms due to degeneration in the spine.
The third issue.
And the third issue is largely osteoporosis when we're talking about the aging spine. This is a very significant issue at times. It's a very prevalent issue in our population, and that's really a thinning of the bone, sort of say. And why that becomes important is that thinning of the bone can cause fragility, and that fragility can cause fractures. And much more important in the postmenopausal women.
My wife's concerned one day she's going to wake up and just be a pile of dust. Yeah. We can't stop ourselves from getting older, and we don't want to, but is there anything we can do to keep our spine strong?
Yeah, there's many things that we can do to maintain what I call good spine health. And the good thing is they're all going to be familiar because these are things we should all be doing to live a nice, healthy lifestyle. One of them is posture. I saw you sitting up a little straighter. Our mothers were probably correct. We should be sitting straight up in a chair, and we should walk straight up. That's good for our overall spine. We shouldn't slump in a chair or lay on the couch and that sort of thing. Keeping weight off is very important, especially for the low back. Carrying weight can cause significant pain in that area. Eating a well-balanced diet is critical. There's no special diets for spine. I tell people just a well-balanced, healthy diet is critical for that. Regular exercise is important. That not only is it aerobic exercise, just getting out and walk, for example, but also maintaining good core strength, especially of the low back. And it doesn't have to be anything intense or specific. It can be just 10 minutes in the morning, 10 minutes at night, focusing in on the core.
If we're already having problems, then what?
If you're already having problems, there are some simple things that you can do without even seeing a specialist. You can focus on stretching the back at night or in the morning. Some over-the-counter anti-inflammatories are helpful. If it gets worse, massage therapy, chiropractics can be good for that sort of acute pain you have. And if nothing's helping, probably trying to seek a spine specialist would be important.
And spine specialist would do what? Surgery? Is that the...
No, not at all. In fact, most of what we do, I'm a surgeon, I guess I shouldn't say that, but most of what we do as a spine group is non-surgical. So really? The key thing is getting someone to be evaluated by a spine specialist, determining what the problem is, and then getting him in the appropriate therapy. It may be medicines, it may be therapy, at times it may be surgery. But
Great.
Surgery is usually the last straw.
Great advice. Thank you, Doctor.
Thank you.
Aging may be inevitable, but there are things you can do to help you keep your back at its best. Follow Dr. Steinmetz's advice, and for more help, use the information that's coming up next.
Learn more by calling Metro Health at 216-778-7800 or visit www.metrohealth.org. Want more Metro Health medical information? Be sure to tune in to WTAM 1100 Radio each Saturday morning at 7 for Metro Health and You, hosted by Dr. Christine Alexander. Next, here's a deadline you can't miss.
The newest masterpiece at the Cleveland Museum of Art is the Cleveland Museum of Art, with a soaring, light-infused atrium, completely redesigned galleries for every work of art, and the culinary splendor of provenance. These are just part of your magnificent new Cleveland Museum of Art. Come see Cleveland's masterpiece. Come see amazing.
For most people, the time to sign up for Medicare is when you hit 65. Actually, you can sign up anytime during a 7-month period. The month you turn 65, 3 months before that, and 3 months after that. But for some people, it's smarter to wait to sign up for Medicare, as long as you don't miss an important deadline. Here to explain is my smart law partner, Mike Solomon. Thanks for joining us today. So, when does it make sense to delay signing up for Medicare?
Well, if you're working past age 65 and your employer has health coverage, your spouse is working and has health coverage, and the employer has more than 20 or more employees, then you should consider not electing Medicare. The reason is that the employer's health plan is primary and Medicare is secondary. So you may be paying for a benefit you never get any coverage for.
All right, so let's say that we delay and we turn 68, 69, 70, or whatever. When should we sign up?
Now, if you're working, all of a sudden you're no longer working, or your spouse no longer working, you lose that coverage, then you should sign up for Medicare. And you have 8 months from when you lose your coverage. And that means even if you're covered by COBRA or some sort of a special retirement benefit that the company has that gives you more coverage, you need to do that 8-month period.
What if we don't sign within the 8 months?
Well, if you don't, what happens is that once you no longer have that right to coverage, Medicare becomes the primary benefit, and any health insurance through a private employer is secondary. So if you have a medical need, they can deny your coverage because you should have been under Medicare.
Even if you have COBRA?
Even if you have
something
COBRA.
like that. So are there other downsides to not signing up? I mean, one is not having coverage. What else?
Well, there are other things. Let's say if you wait too long, there's a penalty if you wait too long of 10% of the amount of the premium. So if you've gone past your election period, they can impose a penalty of 10% of the premiums paid. So, for example, right now it's $104 a month. In a year, that would be an annual penalty of $125, and it goes forever. So once you've missed 1 year, that penalty lasts with you forever, and of course, the longer it is, the more expensive.
And are there any other problems?
Well, the other problem is when you finally decide to elect, now you have to wait till the open enrollment period, which is between January and March of the next year. And then when you enroll then, you still have to wait till July 1 to receive coverage. So you still have that issue, and all those penalties are going to start accruing.
And you may end up with a period that you're not covered.
That's true also.
Okay. Thank you for the information. For most people, sign up for Medicare when you reach 65. But if you or your spouse is still working with health care coverage, then you'll probably save money by waiting. But you have to remember, to avoid costly penalties, keep your eye on the calendar and follow Mike's timely advice.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.budishandsolomon.com.
Thanks for joining us. On next week's show, it's time to take a peek at your portfolio. We'll explain why it's important to evaluate your investments. Then we'll look at some home sleep tests to see if they make the grade in exposing sleep apnea. And we'll feature fashion finds of designer exclusive attire. Until though, next week, please remember to make the most of your golden opportunities.